Thank you. Thank you. And, you know, one of the things I like about Fear Free's founder, Marty Becker, is that he's extremely authentic. And I think you will find that with me tonight as well. You heard all my credentials and background and all that. I am just a colleague tonight sitting here and talking about what we do in the practice day in and day out and how we can make euthanasia better. So I am seated in my office here in Colorado. It's a beautiful evening. I hope it's wonderful where you are and you are settled in with either some good food or a nice beverage, maybe an animal on your lap, keeping you cozy. And we can just have some good time together. And this is really about your questions and me giving you my expert opinion on it based on what I've been doing for a long time, what I've heard other colleagues share as their best practices, and bringing all this good information to you. And thank you so much to those of you who already submitted your pre-questions, because that gave me something to build a few PowerPoint slides off of. And then we're also going to dive into some other PowerPoints that I've put together over the years that will help us to illustrate some of these answers for us. So the themes that you put together for me tonight to go over, first and foremost, was about the comfort room and those euthanasia spaces. So we're going to talk probably a good 10 minutes on that. I imagine you've got lots of ideas that work well in your practice and those things that you want to just modify a little bit and just need some quick advice on. We're going to talk about indwelling IV catheter placement, where to do that as far as in the hospital, keeping that fear-free mindset. And we're going to talk about the best use of sedation protocols, and including pre-visit pharmaceuticals, even though I don't necessarily have a whole lot of information put together on that. I did put together a webinar for Fear-Free, probably 2-3 years ago now, that has some good pre-visit pharmaceutical information in there too. And then I'm very pleased to bring you, for the second time, I think, ever that I'm presenting on it, are the 4 things pet owners want the most and expect during euthanasia. That just is fresh off of a study that CAETA did this year in the United States. So we're going to talk about that. And then some of you brought up questions about home euthanasia. And if we get around to it, we'll discuss at least some resources for you, where to learn more about it. But I'm happy to share some of my insights. And in that bio that Jennifer read for me, it doesn't really say that I started out into the euthanasia space by launching a home euthanasia service here in Colorado. And I did that back in 2006. So I was in private practice a couple years after graduation and then started a home euthanasia service. And that is really where I shaped my skills, my approach, and then, moved into helping hospitals capture those really good elements in the hospital setting as best they could too. So this is a very wordy slide, which is not like me, but I wanted to go ahead and put it out there right away that CAETA talks about kind of the 5 S's when it comes to just comfort and safety in a hospital. Our 5 S's. In fact, the first one is safety. Then the second one applies to sensory, then signals, spaciousness, and supplies. So you're already very familiar with Fear-Free to try to avoid, slippery floors. You want to have comfortable things for animals to walk on, to then sit on, for clients to sit on, your staff to sit on. And then you want just enough lighting to see what's actually going on during the procedure. Now, above me right now, I've got an LED light shining light down on me. That's usually not the tone that we have in a comfort room. We try to dial those lights back just enough to see what you're doing. Okay, so kind of think about that. If there's a way that you can soften that lighting. With sensory, biophilic elements, in fact, let's ask the group, what's a biophilic element? So if you could put in the chat for me, if anybody knows what that is yet, a biophilic element. And while you do, I'll just say soothing sounds, sounds that drown out all of those extra sounds that are around the hospital. So we can kind of create a bubble in that comfort room. Ooh, Jesse, I've got like a waterfall wall. Excellent. So what's a waterfall? Bring that down for me even further. So what we're trying to do with a biophilic element is it applies to something. And you're darn close. So let's see. You also want the room temperature at 75 degrees, potentially even a little cooler is good. And then soft things around the room for sure, like pillows, blankets, and those carpet and rugs. So carpet and rugs helps our animals to get around safely. You know, we've got some good traction, but in general, it helps to deaden sound in the room, as well as conveys just softness, right? AKA a living room. All right, biophilic elements. I'm going to come back around to it. This is a good example of nature, right? So Jessie was right there, natural and soothing. There we go, Penny. So nature. So we're talking about plants, images of flowers, water sounds, actual water in the room. Perfect. So bringing nature in is very soothing. In fact, I'm going to attempt to do something a little bit unusual here if I can show it. This is in my comfort room up above. I actually brought in a branch and then glued leaves and flowers onto it. And this just kind of helps to create a little bit of a canopy that immediately brings in nature. And then on the other side of my room, I've got plants and lots of biophilic elements. So you want to get that in there. Love it. I've got a fear-free color palette. Fabulous. So the way that you can color your walls. And we're going to look at that here in just a moment. And then I'm going to move along to signals. So these are markers just outside the room to notify staff that a euthanasia is taking place. And then you can also do these wireless doorbell alerts. If you could put in chat, are you already using those in your hospital? These wireless doorbell alerts that allows the family to stay in the room so that they don't have to step out and find you. So if you can put that in chat, I'd be curious. Wonderful. All right, spaciousness, room for loved ones to gather, preferably on the floor or on couches, things like that. So there's plenty of space. And in particular, you want to be able to face them. I actually went to a hospital and toured, and the room was so small that often when the vet was performing euthanasia, the family was seated behind the vet, and it was difficult for the family to get right there and engage. So think about that flow and that feng shui, and making sure that everybody can face each other and essentially create a little circle of love. That's ideal. Wonderful, Rebecca, sharing that using an enclosed outdoor garden for exams and euthanasia. Perfect. And yeah, you miss it. You don't have it anymore. I also have a memorial garden here at my center. It's relatively large. I'm very lucky to have it. And I've got a labyrinth out there, and we've got some memorial plaques. We've got a shade tree. You know, just very, very blessed. So if you can create something like that, please do. And then supplies, everything in the room that's ready for euthanasia, so you don't have to step out of the room and get more supplies. And I'll show you a picture of that here in just a moment. All right, so comfort rooms, additional features. Think about having those carts and stretchers nearby so that you can quickly move a pet, a large pet in particular, or one that is immobile, to help get them into the comfort room without that extra effort on their part. This is a little bit of a unique one, but furniture extending all the way to the ground. So they're often, well, it depends on the way your comfort room is designed, but you might have coffee tables and corner end tables, or I was in a hospital that had a futon that the family sat on, kind of like shaped up like their couch. And there was lots of nooks and crannies for animals to get under. Now we want them to have sanctuary spaces, as the third one says, if they're feeling anxious, so that they can get away from things. But we also don't want them going so far under that now it's hard to get them back out. So you want to control where these animals are going to go to find that sanctuary. So in my comfort room, I've got a end table, or like a, kind of a, just a side table basically next to the couch that is perfect for little animals to go underneath if that's what they want to do. But I also know that I can easily pull them out when I'm ready to work with them. So just thinking about the sanctuary spaces. We already talked about dimming that overhead light. Blackout shades on the window are wonderful for that extra privacy for everyone, especially if you're in a busy area. Let's always remember those pheromone diffusers, products by like Siva, for example. And then we always recommend to use a non-residential deodorizer. So a smell that is not going to be familiar to them when they go home and smell it again. So let's just use Lysol disinfectant spray, very classic smell, and that could actually trigger some grief. So we recommend using a very strong deodorizer, but that's unique to death care. And a good brand of that is Shiva Shade. You can look them up online. Shiva Shade, they make really good deodorizers. And in general, Fear Free is to try to cut down on a lot of those unpleasant scents that are going to be in those spaces. So a good one there is Shiva Shade. Then you want non-direct facing animal images on the wall. I believe you're already familiar with that. We're a big fan of a room fan to circulate air. To us, that's a little bit of that biophilic element as well, the wind. And animals that are in distress usually do pretty well with circulating air. It can also create a little bit of sound. Okay, so just a tiny little fan is good. Then one of my favorites is frosted glass windows for added privacy. We talked about, kind of those blackout shades, but some of the rooms might have, or even entrances into the building may have fully glassed doors or windows that animals can see through that can cause them a little bit of stress when they're coming in for euthanasia. And so Heather, I can't believe I'm blanking on Heather's last name at the moment. It's been a long day. Heather Lewis with Animal Arts went in and did some reviews of comfort rooms with me. And that was one of her recommendations, was getting in that frosted glass for added privacy. Definitely do lots of treats and treat lick mats. If you've got those, you can put out candles. And then one of my absolute favorites is just an image of the human animal bond outside of the comfort room that you can stand and take a pause with. Take a deep breath and relax you so that when you go into the room, you convey that calm demeanor. That should relax your patient, that should relax your family and set you up for success to build good rapport. You can put a dry erase board that can be updated with a pet's name in the room, so the room is dedicated to them. You can have art therapy kits for children to keep them busy, always good. And then you can have families bring in those special items from home, like toys and beds, favorite foods. Never forget a family brought in a bowl of bacon grease for their golden retriever to just lick and lick and lick and lick while I gave it its pre-euthanasia sedative, and then fell asleep just licking bacon grease. What a great day. Then, of course, water and other refreshments for clients. I'm going to go ahead and kick out of this PowerPoint presentation for a moment, and I'm going to pull up a different one. Here we go. This is a presentation I gave many years ago, and so I just wanted to show you some pictures. This was an example of a comfort room, actually at a crematory. And they had carpet here along the ground, and then they just put an extra area rug. You are likely not going to be able to have full wall-to-wall carpet in your facility, but you can roll out those floor mats. You can even roll out a carpet just for the appointment itself. Then here's an example of some carpet runners down the hall to the comfort room. I'm sure you've already had assessments about your flooring in general, but here are just some examples of other hospital flooring. And then we kind of talked about all this already. Here is an example of my older comfort room. I just recently remodeled. What I really like about this is certainly a lot of natural light. It's extremely private, so I don't have to worry about, looky-loos and people walking by. But when we want even more privacy or to darken the room, we can just close these curtains for these French doors. And it also has a private entrance. So for sure, we want with those comfort rooms to have them as private as possible, ideally with that private exit for when the family departs. But you can see it looks just like a living room. In fact, there's another example in that room of that canopy of branch and leaves and flowers. Okay, more biophilic elements there. And then on the other side of the room. This was actually a designated animal hospice facility in San Diego, which I thought was really, really pretty. And this was actually their comfort room. So they had just a dog bed in the room, but you can see this flooring here, high slip surface, but still able for them to put down a big mat or an area rug if they wanted. You can notice here how this furniture, it would be easy for an animal to go underneath. Again, it's fine as long as you can get them out when you're ready to work with them. And if we do think that our animals are going to be fearful, what an opportunity to give those pre-visit pharmaceuticals ahead of time. There's another comfort room there. And I'm just going to go ahead and look to see if there's anything else I wanted to grab on this one. Oh, I do think I've got a color wheel. There it is. Here is an interior design with color choices. And in particular, these were the colors that we went over during this talk. I tend to gravitate towards greens and blues. Greenish blue color is actually the interior color of my comfort center, but green is tied with loving, as is blue usually, and is healing. Okay, so healing and feeling a sense of calm and peace. So there you go. In fact, just for fun, because I can tell you this, if you've taken the personality test True Colors, orange tends to be more adventurous people. So it's interesting that it's with creativity. Yellow tends to be more power and money, which is interesting there with courage, self-esteem, willpower. And then light blue is usually more loving and nurturing, which I found interesting. And green is actually tied more to science and research and learning. So there you go. All right, I'm going to kick back off that and go to here. By all means, if you got some good questions, I'd love to hear them in the chat. This is that little dry erase board that I recommended putting in the room. This does really nothing for the fear-free experience per se, but I like it because it gets me and my staff in the zone of caring for Ruby, right? Once we write this on the board, that's where our focus is. So we get to forget about things behind the scenes and what's going on and what laboratory results we need to look at and who's coming in later in the day. It's all about Ruby right now. And so it's a bit of a mindfulness exercise to write that down. Families love it, absolutely love it. They almost always comment on it. And then after Ruby's passing, then we will clean this off. And that's again, part of our kind of ceremony after completing our care for Ruby. So before I move on to indwelling IV catheters, I'd like to see if there's any more questions on comfort rooms that you might have had specifically to talk about. If you've got the thumbs up for me, you can just say thumbs up, ready to go forward. All good, or I'll give just a second before we move on to catheters. And by the way, for catheters, if you would, maybe in the thanks for that, maybe if you would in the chat, would you please tell me when you are placing IV catheters right now? So are you placing them in treatment? Are you placing them in the room with the owner? Are you placing them with, like it says, pre-sedation before anything else? I would just kind of love what you're doing now. There's always an opportunity to make improvements. That's why we're here.
It looks okay, like we do have a question there, Dr. Cooney. I don't know if you saw that from Penny.
I sure do. Thanks, Penny. So we've got an outdoor gazebo now to work with. So suggestions for using it. Yeah, I'll probably need to signify somehow to the staff to stay away if there's a euthanasia that's going on. Might even be able to put something on the sidewalk or anything around it that says, you know, peaceful transition in process or something like that, or private family time, come back later, something like that, so people stay away. But that would be a good opportunity for soft music to play to drown out other, you know, exterior sounds. Bring your blankets, bring water on hot days, bring tissue out with you. And then when possible, you bring out your actual kit so that you've got everything at the ready so you don't have to be popping back and forth. Good. All right, so Jesse is sharing some truth here. You're so kind. So the clinic I work for refuses to use IVC despite being a fear-free clinic. So it's okay, first of all, to use direct venipuncture, butterfly catheters, and indwelling IV catheters as long as our patient is sound asleep. If they're awake, then there's more risk, right? If that vein blows, if the drug gets outside of the vein and causes pain, that's what we don't want. So if they're using something else, like a butterfly or Direct venipuncture, again, okay, as long as the animal is sound asleep. It's not ideal though, right? So the AVMA, and I believe AHA too now, and certainly CAETA says that indwelling IV catheters should be placed whenever applicable, right? Whenever that's possible, just to cut down on that risk. So, all right, so where we're going to get to with this is that CAETA advocates for, with the help of Fear Free, to provide pre-euthanasia sedation before any technical aspects of the appointment gets done. Many reasons for this. Number one is that we want to cut down on fear, anxiety, and stress of our patient. So instead of added restraint with trying to place a catheter when they're awake or bringing them back to the treatment area, we're advocating for something to be given IM or sub-Q in the room, help them to relax into deep sleep over 5 to 10 minutes time, and then we move forward with the procedure. And that procedure is going to be either placing an IV catheter, ideal, or you may be moving forward with an intra-organ euthanasia injection. Okay, but the big ask here is to do everything in the room. And this is what our families have been asking for. And this is what new research shows. Number one thing they want is to be with their pet all the way through, or at least have the option to be with their pet all the way through, because we know some families just don't want to be there. That's okay. But if possible, we would have them there while that pre-sedation is given. The animal can fall deep in sleep in the comfort room. And then when the pet is unaware, then the family can depart, and that reduces that FAS from our patient. Okay. Let me take just a quick look at what's coming in the chat, and then I'm going to move to another presentation and go over some protocols. So good, they're sedated. Oh, thanks, Jesse, for the clarification. So they're sedated with teletamine, completely asleep. All right, well, that's better than not. So that's at least a step in the right direction, Jesse. Then you can advocate for what I'm not sure if Fear Free has actually taken an exact stance on this. Do you know, Jennifer, to place an IV catheter?
We have not taken an absolute stance on it, but it's certainly encouraged to place a catheter when possible.
There you go. There you go. All right. So Lisa's sharing on our mobile unit. We do not use catheters after sedation, so animal doesn't feel it. Also, if you have a difficult time getting the cath in, it can cause fearful response from the owners. Yeah, it can. It absolutely can. So we want to be reaching for those drugs that are going to keep blood pressures up, keep cardiac output up. If we're worried about flat, just vasoconstricted venous pathways that we can't get access to. So when I train new doctors, or at least used to train new doctors with my service, we would always have them work with dissociative drugs like teletamine or ketamine, just to keep that cardiac output up and those blood pressures strong. And that made for more successful venous access. That being said, it also provided an opportunity, since these animals were now unconscious, that if we couldn't find a vein without poking around and causing stress to that family, we could just move forward with an intra-organ injection. So with that, I'm going to go ahead and step out of this presentation and pull up a different one. There it is. This is our Euthanasia Reimagined presentation, which we're about to make complimentary on the CAETA website so that you can learn with us. I'll just show probably right here. Let's do this one real quick. And if it's all right, I'm just going to leave it like this, but just a little bit bigger so that I can see what else is coming up. I'm going to think Dr. Cooney shows the messiest webinars ever, but hopefully this isn't too bad. So yeah, choosing the right technique is going to be number one, your comfort and skill with it. So if you don't have comfort with IV catheter placement or just finding veins, then let's learn more. Same with intra-organ injections. You have to have the right supplies to do particular techniques. So for example, today I euthanized a dog at the local animal shelter with an intracardiac injection. I needed at least 1.5 inch needle on that dog. 1 inch wouldn't have done it. So had I not had that length, I couldn't have done an intracardiac. Presence of pre-euthanasia sedation or anesthesia, same thing applies. We need our patients in unconscious state, fully anesthetized before we do anything intra-organ. And then the presence of onlookers. So yeah, if we're worried about fishing around for veins, maybe it's best just to switch and go for an intra-organ, or vice versa. Maybe, you might not feel comfortable doing an intracardiac with a family watching, but the way that we teach it is fear-free for you. It's very, very easy to do an intracardiac, even with an owner there, just with changing the technique a little bit. But of course, we want it to be fear-free for anybody who is watching, including our family. It's going to depend a little bit on your type of euthanasia solution and the amount that you have, the physical condition of the pet, and then the need for a postmortem exam. So if we're going to be doing, sending a patient out for a necropsy for liver disease, we don't want to do an intrahepatic injection and bathe that liver full of pentobarbital, for example. Okay. So let's go ahead then and move to my sedation protocols. I'm going to go ahead and go full screen on this one, so you can see that a little bit better. Now, before we started this meeting, I was talking to Jennifer about a new product of just medetomidine. So I just want you to know that Fear-Free and CAETA are looking into that product to see if it'll be useful for pre-euthanasia sedation and or an additive to an anesthesia protocol. But this is my current one, and it's very tried and true. Been using it for a long time. So you're welcome to take a quick screenshot of that. And by the way, I have a sedation protocol for dogs and I have an anesthesia protocol for dogs. In a moment, you're going to see my cat protocols, and they're both anesthesia. I don't have a sedation protocol for cats. And it's because most of my cats I euthanize via the intrarenal method. So I need them beyond heavy sedation. I need them in anesthesia. So to be clear, what we're doing here is the patient comes into the hospital. We are guiding them with their family directly to the comfort room. We are going through the last minute paperwork, making sure that we have everything ready for them. Then after payment is collected, if it wasn't done ahead of time over the phone, which I definitely advocate for, then I give gifts, right? So I usually give my pet loss guide, which I'm looking to see if I have one next to me. I don't, but I give my pet loss guide and information about the aftercare service if I've helped to make those arrangements for them, and maybe another little kind gift. Then we move into the euthanasia procedure, and I talk them through, letting them know I'm going to give a sedation first, then followed by a second medication, which will be for euthanasia itself. And then we go ahead in the room with the family, give either a sedation protocol or an anesthesia protocol, either IM or sub-Q, just depending. And then when the patient is deep in sleep, then we move forward with euthanasia. All right, so moving along then to the cat call, there you go. Alone, if anybody is using that one, yes, it's a higher volume per cat, but it's a really great drug. It's that neurosteroid anesthetic, and it's benign neutral pH. And we know that teletamine and ketamine have some heat to it, as does midazolam's got heat to it, right? It's a low pH, those are low pH drugs. Alfaxolone is very neutral. So while it's a greater amount that you're giving, it might as well be like giving saline, or at least that's my experience with it thus far. And I also like alfaxolone because it takes away those dissociative effects that we sometimes see with our feline patients. Now, I'm not using alfaxolone in dogs, but if I was, it would probably be for dogs under 20 pounds, just because of the sheer volume that's required. Okay, like it starts to get expensive. Then you're just burning through alfaxolone like crazy. So you're probably asking yourself and ready to ask me, Dr. Cooney, how do we get rid from teletamine and ketamine and midazolam? Well, the jury is still out on what's that perfect recipe to get rid of it. I've heard a lot about B12 to add that into protocols. Some people swear by it. Some people say it doesn't make any difference. Average is around 1 ml of B12 that you can add into the syringe. I often just use plasmolite or saline. It's kind of like that dilution is the solution to pollution. So if we can just kind of dilute that syringe out a bit, in fact, drawing up your teletamine or ketamine protocol first, and then flushing in the rest of the syringe with saline, that's typically what you're pushing in first, and should just help to kind of dilute that area. I am currently about to start a research project with carbocaine, mepivacaine, to try to add in some local analgesia to the syringe itself to see if we can numb that quickly or neutralize and see if that makes a difference, but to be determined. And then we've got a dear colleague out of North Carolina, you North Carolina team out there should love this. But our colleague, Dr. Beth Marchitelli in North Carolina, has been working just with bicarb and working in a bicarb cocktail and getting that pH to 7 before she injects. And she's been very successful with that. So we're hoping that with that fear-free approach that we are getting these animals in a deep state of sleep. It's not a light state of sleep, it's deep. So it's important that we let our families know the reality of that. You know, she's going to work into a very deep sleep. And then when she's ready, the second medicine will be given to help her to pass. That way people get emotionally prepared to say goodbye. And once you give this medication, we encourage you to then maybe ask a good open-ended question, such as, how did Molly come to be in your life? If you don't already know that, of course. If you already know the background, you're going to have another question that you're going to bring up. But if you don't know that yet, how did she come to be in your life? And if you get a great answer, this is not a talkative family, and it's okay to just be quiet during the sedation time, but you're still going to want to describe to the family how their pet is going to relax. Okay. So would that be helpful to go through that, everyone? A little bit of my narrative. In fact, I'm going to kick out of this and go here, and I'll look at the chat to see if that would be helpful. I can certainly go through my narratives. You let me know. Oh, and then I see another thing here from Jesse. There we go. So the question is, when you use the ACE protocol for dogs with that tetraethylamine, with that ACE and dexmedetomidine, does IM injection? You know, IM injections in general have the potential to sting more, right? It's just deeper tissue, and there's a lot of nerve endings there compared to ACE. But we've seen plenty of animals react to sub-Q. So if we're worried about that, I mean, if we're really worried about that, then my recommendation would be to do what's called a two-step protocol. So what you're looking at right here with these combos on the screen here with the cats, with the anesthesia, IM or sub-Q, I've got tetraethylamine, ACE, promazine, and butorphanol. That is all in one syringe. But if I'm worried about that sting, I can give a two-step protocol, and I can start with just ACE and butorphanol. And I give that in the apaxial muscles if it's going to be IM. You can also give it in the apaxial region for sub-Q, or just do it in the nape of the neck, and give your patient, 5 minutes to just welcome in those two drugs to relax them a bit. And then when you can see that visual relaxation, then you go with a combination that's going to have a little bit more heat to it. Okay, just to take that edge off and decrease the risk. With the dogs, by the way, I've got my dermosidan gel right here. I love this stuff. It's detomidine gel. I use it all the time with my smaller dogs in particular. When they come in, if it's clear that they are going to be sensitive and needle averse, I just ask the family if it's okay. I'll go ahead and give a little oral medication. And then when they're relaxed, then I can go ahead and give more medication to help them to go deeper. And by the way, it's helpful to actually get the family involved with those questions. So ask them, is your pet painful anywhere I should know about? Again, if you don't know this pet and you haven't been working with it closely in the last 6 months. So, are they sensitive anywhere that I should know about? And they're like, oh, they hate needles, or yes, don't touch the back end, which is so common. Then you can make a decision together, especially with the dogs, to say, I've actually got a little oral gel that I can give to relax her before I give an injection like a vaccine. What do you think would be best for her? And it kind of puts a bit of ownership together, partnership together in making that decision. And I think that's a good idea to ask and not assume, because we might find that the little dogs are more sensitive to their mouth than anywhere else, right? And so it might actually be better to give an injection, again, maybe doing a two-step protocol with that butorphanol and ACE, then with something stronger like tetraethylamine or ketamine. But then you're working in partnership. Okay, but ask them, are they sensitive anywhere that you should know about? A couple of things in chat here. What are your reasons for dexmedetomidine versus xylazine as seen in previous CAETA materials? You're right. So for 8 years, with my end of life service, I use xylazine. And then a colleague said to me, Kathy, please just switch to dexmedetomidine. And I promise you, you will like it better. I was using xylazine because it was less expensive. It's what I was taught with. And why not? I barely ever had nausea, wasn't a big deal. But once I switched to dexmedetomidine, I was like, oh, this was night and day different. When they went to sleep, they stayed sleeping, never had nausea issues at all. It was just extremely rare. And my pressure stayed fine. And I loved it. So even though it was more expensive to me, it led to better medicine, better outcomes. And that's why I switched. So if really early CAETA materials, including my home euthanasia book, talks about xylazine, that's why. But now I've switched to dexmedetomidine, and I'm always, pioneering, looking for other drugs that could be better, like medetomidine. So I'm going to be exploring with that soon too. But xylazine, yes, less expensive than dexmedetomidine. Dexmedetomidine, a far superior drug, much more targeted and efficacious. All right. After giving sedation, Lisa says, many times we leave the room so the owners can be with the pet. They have a remote bell to push and come back in, and then you come back in after 10 minutes if you haven't heard the bell. That is good. I'm going to maybe step it up one more and say you can actually be present in the room without really being present. So I am in the room all the way through every appointment until the family is ready for privacy, either just before euthanasia or after the pet has passed. The reason that we advocate for hospital staff to stay in the room is because if your patient gets into any sort of distress because of those sedatives, you are there to handle it. If the family has questions about what they're seeing, you're there to address it. And you can be present without really being present by just asking that open-ended question. If they just give you a short little curt answer, they don't want to talk, you just sit and be quiet. You just kind of melt into the floor. You're still present, right? You need to be in tune with the emotions in the room and what's being said or asked of you, but you're just otherwise there, right? What we do, we call it mouth closed, ears open, presence available. And that way you can address anything that comes up. So I remember working with hospitals over the years, and we would give the sedative and then we'd step out into the treatment area and just wait for either the family to press the button or we just go back in. And I remember like, what's happening in there, and what's my patient doing, and are they okay? And worried about seizures, who knows, even though seizures are super rare, I would just hate for something like that to happen, or vomit. So we do recommend that you stay present just so that you can address anything that comes up, but you can be present without really being too over the top in their face. Okay. So this is a blog that CAETA put together, over a year ago. We call it Oral Pre-Visit Pharmaceuticals Go Big. These are doses like the chill protocol on steroids, like super high, right? So we advocate for going above and beyond what you would normally give for non-euthanasia procedures. Okay, so if you're wanting to know more about that, you can. Fear Free is not necessarily signed off on this. I just want you aware of it, that more often than not, the pre-visit pharmaceuticals that you may be giving for euthanasia purposes have not relaxed them to the point that you want them to be relaxed. I do a fair amount of behavioral euthanasias here in Colorado because other services don't have the time right now for them. They're understaffed. They need to be helping the hospice patients and the geriatrics and those with terminal conditions. So they turf their behavioral euthanasias to me. So what I do is I go with higher doses than what most would give. So again, love my detomidine gel. All right, I was just going to see if there's anything else on this particular presentation that I want to show that would be useful for us. No, I think we're pretty good there. I'm going to jump back to the Fear Free. All right, so with that theme of placing catheters in the room, the number one thing people want, even though it's not showing this in this order, is they want to stay with their pet. So if we've still got the protocol in our hospital to, do paperwork, and while paperwork's being done, the technician brings the patient back to the treatment area, with the pet awake, the catheter is placed, and then they're brought back to the room and propofol is administered or something else IV immediately by euthanasia. During that separation, it can be anywhere from 5 minutes to 20 minutes that I've seen. That's unknown time, and it's lost time for the owners. They don't know where their pet is. They don't know what's going on. They can picture it. They can imagine it. And they worry if they hear sounds in the treatment area of what that means. So we, through this study, 90% of families said when they want to be there for euthanasia, they don't want to be separated from their pet at any point. Okay. Now, how you help to prepare for that is through some more pre-planning with your family. So they want to be empowered and be educated about what euthanasia is, what they can expect, give them voice and what's important to them, like who they want to be present, where they want to gather, special touches, things that they can bring in for that fear-free experience. But all of it together is good for our pet patient, right? They don't want to be separated. They don't want to go back to the treatment area. They want their family to be relaxed and comfortable through the pre-planning. All of that creates this just more gentle, calm picture for this patient, which leads to a smoother euthanasia experience. Pet owners clearly want sedation. That's what the study showed, and I'll give you access or information about this in a second. But they clearly want sedation for their pet ahead of time. But they did indicate that the pet does not have to be sound asleep for it to still be a good euthanasia experience. However, we advocate for it because we know that that's going to decrease the most anxiety and fear for these patients, is to have them completely out in deep, deep sleep before they are euthanized. Okay. That way, if you are fishing around for veins and those things, your patient is completely unaware of it. And then absolutely, they want their pet to be pain-free. So again, sedation helps to make that. So we want to reach for those really good protocols that eliminates pain on injection. That's important. But then slow down, take your time, try to be less clinical during euthanasia. And all of that put together will build trust in you. And so if things do get challenging, and we call that a dysthanasia, if it does get challenging, the owner is more likely to forgive you because they are sensing and feeling your compassion and your honesty and your humility, your desire to serve and to do right by their pet. That's really important. If you don't have that established, then they're more likely to be upset. That's when you get the negative reviews and they tell everybody about you. And next thing you know, you've built up this lousy reputation. So it's extremely important that we slow down and try not to make it quite so clinical. And I have a feeling all of you are doing really good out there. If you're already working through or have achieved your fear-free certification, then you're already leaps and bounds above many other hospitals out there, but we can always do better through additional learning like this. So we already did those sedation protocols. And let's go ahead and end with at least what I've put together for you with just a little bit of information on house calls. And then if you would, please in the chat, let's add in a few more questions that we didn't get a chance to address yet, because I've got 10 more minutes for you and we've got lots of stuff we can cover. Those of you interested in house calls, I encourage you to take the CAETA Master Program. It is, I don't actually have, I might have to jump back to another website for it. I'm sorry, a PowerPoint presentation for it. But the CAETA program, Companion Animal Euthanasia Training Academy, has a 10-hour master program to teach you euthanasia best practices. Once you complete that, you can take it at any point, but you can also take the home euthanasia module that we created at half off. Okay, so you can just pay for it as is, just take the home euthanasia module, super, super helpful. Or you can take the master program, learn from that, and then get this home euthanasia module half off. So I'm not trying to sell you anything. I just want to give you resources so that you know where you can learn about good targeted euthanasia education. Then many years ago, 10 years ago now, I wrote a home euthanasia book, and you can buy that off of Amazon. I almost want to say Barnes and Noble, you can get that as well. I think I've made $30 off that book in the span of the last 10 years. Books are generally not big money makers. but it is a wonderful resource for you. So I encourage you that if you want to learn about home euthanasia, to go ahead and explore that. There's also now Dr. Eve Harrison's group, the House Call Vet Academy, where she can teach you home euthanasia tips and tricks there, and just, of course, how to run a house call, do some more house call work. So with your fear-free hospitals, what I strongly recommend is that you shape and hone your euthanasia protocols in-house. And then you take all that good knowledge and you then move that into the home setting to further support those families that would love for you to care for the pet there. So you can be a little bit more of everything to everyone in that. You know, there was something I wanted to show you. Let's see, I do this home euthanasia module right here. This is the one I wanted to show you. So this is actually my doctor bag. And I use this doctor bag in my comfort center here in Colorado. And then this is the bag that I would bring into the home environment as well. And inside of it, I have my drug box, which is right here. I've got this drug box that holds my drugs. And then I've got every catheter I could need, and needles and tourniquets and gauze wipes. And I've got paw prints in there. I've got my pet loss guides. I've got gloves and all that. So everything's at the ready in my little bag. So when I go into the home, I don't need to go back out to my vehicle. And then what you see here on the left is an example of one hospital's little supply kit where they bring everything in with them. And the only thing you don't see here is the drugs. And then they just bring those in at the actual appointment. But this little supply kit can just be tucked away in a drawer or underneath the sink or wherever in your comfort room. And you just bring that out when you're ready for the appointment. So somebody has to keep those stocked and ready to go. But that way everything is there. So when you enter into a euthanasia appointment into the room, you can literally be there all the way through. If the family never needs privacy, then you stay there until its entirety, until you walk the family out to depart, or they walk out on their own, just depending, and you stay in the room and you go ahead and prepare the pet for aftercare if that's what the family asked for. But otherwise, you might be, spending a lot of time with them. And then when the pet is in deep, deep sleep, you're ready to move forward with euthanasia. That's when you can offer privacy, step away. They press the button when you're ready to come back in, or they're ready to have you come back in. You proceed with euthanasia, then you ask them if they want more time, privacy, and you can step back out. All right. So that was on the home euthanasia slide that I just wanted to show you there. I think that's good for that. What else would you like to talk about tonight? I'm going to go ahead and stop sharing at the moment and just go back to all your pretty faces. What else do you have for me tonight?
Dr. Cooney, you mentioned that in cats, you generally do intrarenal injections. Can you give a little insight? I have a suspicion as to why, but I'm curious if you could explain for everybody why you choose to do that versus doing IV injections with your cats for the actual euthanasia.
Yeah, good one, Jennifer. Intrarenal injections, I think, are very eloquent. They're very simple, and they are in the top 3 of most efficient techniques as far as shortness of time to death. So we know IV is very fast and under a minute. We know intracardiac is very fast, under a minute, and so is intrarenal. And what makes it so eloquent is that it's as effective as an intracardiac injection, if you will, but you don't have the rib cage around it. So, that can be something that's a little bit difficult. You can't feel the heart, besides if you're lucky to feel the beat, great, where some of the landmarks are. But with that kidney, you can actually feel it isolated in your hand. And then when you're injecting the euthanasia solution, which the current volume is in the United States is 3 mils typically for an average cat. So it's like 3 mils per 10 pounds, average cat around 10 pounds. So about 3 mils. I actually give extra. I give 6 mils per cat. That's my normal, but that's my choice. And I do it because when I'm injecting the kidney, I want it to swell. I want to feel some pressure against that renal capsule. And if after the first mill, I'm not feeling that swelling in my other, the hand that's kind of isolating the kidney. In fact, would you like to watch a video of this? Would that be helpful? Well, let's do that. I can do that easy enough. So it is not in this presentation. It's in this one right here. So I will go ahead and show you an injection of an intrarenal, if this would be useful. And you'll notice my left hand is going to hold the kidney. It's the left kidney that I'm holding, and I will inject with the right hand. But using a little bit extra solution in the syringe, if I don't feel the swelling after the first mill or two, I can just redirect my needle a little bit in that renal tissue and keep infusing in that pentobarbital until I feel that swelling. And research that I did over 10 years ago, but we just published really officially earlier this year, is that if you can feel the swelling, over 99% of your patients will die in less than a minute's time. It's that quick. So that's why I like to do it. And it also means that I don't have to clip. Fur and worry about any of that. I'm going to go ahead and turn that down, and we'll go ahead and watch. So we don't have to worry about flat veins and those blood pressures. And so I've got this darling little girl fully anesthetized with a Thielzal protocol. She's covered with mats. And so it took me just a little bit longer to feel that kidney. But I'm just going to go ahead and slowly start to infuse in that euthanasia solution. And in a moment, you'll watch a big breath. There it was. And so I haven't even finished the injection yet. In fact, you're going to see me move my left hand over to show how you can kind of shield that from owners if they're right there present. And that's it. Okay, so very, very effective, reliable. And the only time I wouldn't do that injection is if the patient was very obese, very overweight, or had a lot of abdominal fluid, and it was just about impossible to isolate that kidney. So good question. Yeah, I'm a big fan of intra-organ injections. In fact, we did a study at the International Association for Animal Hospice and Palliative Care conference a couple of years ago. And intravenous technique is still most common in dogs. It is still most common in cats. However, intrarenal came in at about 40% of the respondents said that that is their preferred technique in cats, was intrarenal. All right, so Jennifer, if it's okay, I'm going to address these last two questions and then we'll call it a night. Love it. All right, so from Penny, do you do anything days after, such as to check in with the family? You do like to send an email a couple days later, checking in, let them know that you're thinking about them and how they're doing and how the other pets are. That's wonderful. And yeah, I do encourage that. Certainly a sympathy card is normal within a week. I know groups that do a follow-up call the day later. You can do an email, which I think is good because then families can decide if they want to engage with that or not. So I think that's really helpful, but I think it's great just to check in. If you believe that you had a dysthanasia, right, where things just didn't go well and you're worried what the family's feeling, even if you suspect that they might not be feeling that things went smoothly, just let them know you're going to be reaching out to them in a day or two just to check and see how they're doing. And that basically then is an opportunity for them to speak up and they can then voice any concerns that they have. I'm curious from Claire here, I'm curious if you have specific resources about behavioral euthanasia like a CAETA module. Yes, we did, or we do, not we did, we do. And you can find that on learn.caetainternational.com. And right here, Claire, that I found that drug protocols require a lot of adjustments for these patients. You're right. Again, I like to give more. And we don't necessarily go into drug protocols specifically in that module. You're going to find more of that in our blog. And that is just, again, CAETAinternational.com. I'm not a very good self-promoter, Jennifer, can you tell? I'm going to go ahead and put that in the chat. It's oh my goodness, international.com. It's hard to speak and type at the same time. And then if you actually want the modules, you want learn at CAETAinternational.com like that. that's the better way to go and get easier access to those modules. And Fear Free has lots of good information about pre-visit pharmaceuticals that you should be relying on. They've got anesthesiologists that give lectures that can be wealth of information for you. So keep learning on that. I think the takeaway for behavioral euthanasia is more with regards to euthanasia is warranted. So I'd always recommend that. And then Lisa, last question is, how do you suggest discussing this technique with owners? Good question. For any intra-organ injection, I just lay my hand over the area and I say, we're going to give what's needed here. And she'll pass immediately or within just a minute or two. And I'll listen to her heart and let you know when all is quiet. Okay. So I'll also say that if I was planning on placing an IV catheter and even told the family that, and for some reason I'm struggling with it, I just go ahead and put away all my IV catheter stuff. And I just say, she's ready now for the next medicine to be given. I'll give the medicine here and she'll pass within a minute, or within a few minutes. Everybody's been extremely accepting of that. And if they ask, are you giving it into the heart or are you giving it into the kidney? You say, I am, but I'm using it as an area of good perfusion and blood flow to move the medicine to the brain where it does its work. Okay. So that way people don't think that you're trying to kill the heart or anything like that. So it really does shine a better light, a safer light on those intra-organ injections. And with that, I think it's a wrap.
This has been great, Dr. Cooney. I can't speak for everyone, but I'm going to speak for myself and say I learned a ton. So thank you so much. And I learned what biophilic elements are. That was that was great. This was very helpful, and I think all of our attendees learned so much from this. So